Kristen.
Thank you.
So tell me what bothers you most, and let's discuss how we might be able to make things better.
So I would really like to have my eyebrows lifted and my crow's feet addressed. And then of course my frown line.
Terrific. We can definitely deal with all of that. Why don't you look into my mirror and let's talk about it together. So let's just talk about how the Botox works. What we do is we address the muscles that create the lines by pushing the skin into crevices. So for example, around the crow's feet, what we want to do is relax these little lines, which are the result of a big circular muscle that goes around the eye. In addition to creating the crow's feet, it's actually tugging down on the lateral part of the eyebrow. So it's pulling your eyebrow down. So we get a double advantage by treating that area. Not only do the crow's feet soften, but your eyebrow can go up a little bit.
Okay.
Then with the forehead, what we want to do is make sure that we address the horizontal lines, but only so much that we don't over relax that muscle. There's only one big sheet-like muscle that keeps the eyebrows up. It creates the horizontal lines, but it also maintains tone in the forehead. So if you overdo it, the eyebrows can actually sink. So there's a strategic way of doing it, knowing the anatomy, that you can actually raise the eyebrows and also soften the horizontal lines.
Okay.
And lastly, the frown lines are the result of some muscle action that affects this area right between the eyebrows. And as you probably know, there are muscles that go over the top of the eyebrows that push toward the center. That's what generates the frown, those lines that we all love to hate. In addition, the little horizontal ones that develop on the bridge of the nose are the result of that frown line complex. The goal, again, is to relax the muscles that generate the lines. The lines aren't going to go away immediately because the collagen fibers have been crunched down into a crevice. So we want to relax them. Over time, they will open up and flatten, and that whole area will be smoother. So the goal of the treatment is to do the injection, wait 2 to 3 weeks, evaluate the movement. If we're happy with how relaxed everything is, then that's it for another 3.5 to 4 months.
Okay.
At that time, you come back and we treat you again because we want to keep those muscles relaxed. We want them to lose their muscle memory and keep that area nice and smooth.
Okay.
So I'm going to get a few things organized and then we'll go ahead and do your injections.
Okay, sounds good.
All right, Kristen, we're going to have just a little pinch right here. And another one right at the tail of the eyebrow. That's going to help get that eyebrow up for you. And then let's come over and address your forehead. Give me a frown. Good. So I'm going to inject right here for the tail of that corrugator muscle. And then I'm going to give you another little one right here at the top of the corrugator muscle. And then we're going to give you one right in the middle, which will address those little lines across the bridge of the nose. Okay, we are all set. You did beautifully. So let's evaluate in about 2 or 3 weeks. If you think the movement is all calmed down to the extent that you want it, then we're fine, and I'll see you again in about 3.5 to 4 months. If there are any areas that bother you, come back and we'll see if we need to add a little touch here or there.
Great.
All right.
Thank you.
Have a good day.
All right, you too.